So welcome everyone to our webinar today on an unavoidable issue, addressing menstrual health supply needs in humanitarian contexts. As Alex mentioned, my name is Laura Haiti. I'm representative of WoMena Uganda. We are an NGO working in East Africa, both in humanitarian and developmental context. So I'd just like to start off today by saying that the fact that we are having this webinar is testament to the growth of interest in addressing issues related not only to reproductive health supplies in humanitarian contexts, but also a recognition that menstrual health supplies should be a part of the dialogue and a part of a holistic approach to addressing the needs of girls, women, and menstruators in humanitarian situations. We have a great set of presentations here today, and the broad aim is to discuss some of the challenges and opportunities and steps forward within the field of menstrual health supplies in humanitarian contexts. And I'll introduce our presenters in just a bit. But I wanted to start with this. So after the 2015 earthquake in Nepal, according to the research that was conducted there, women ranked the need for menstrual hygiene products as their sixth highest priority. That was after food, but before medicine and soap. And yet when the research team asked, none of the women had received any menstrual hygiene supplies within the first month of the crisis. However, 15% of them had received soap. Now, this is not to say, of course, that soap is not important and necessary, and it is so to well-being on whole and also to menstrual health. But to me, this is indicative of two things. One, we are not sufficiently listening to the voices of those that we work with in terms of understanding their needs and preferences, and the humanitarian system is not able to react sufficiently to those expressed needs. And secondly, it emphasizes the downgrading of the importance of menstruation and being able to manage one's menstruation to girls, women, and menstruators in crisis and to their dignity. So menstrual health supplies are often not considered life-saving, and there's very little guidance in terms of implementing programs or provision of supplies in humanitarian situations. Yet girls, women, and menstruators do not stop bleeding whilst they're in conflict, whilst they're fleeing, in transit, or once they reach refugee settlements and camps. And they are faced with various restrictions that limit their ability to manage their menstruation. So this in turn, of course, has an impact on their ability to carry out or access services, services such as food distributions, health services, social activities, school, and that further impacts their dignity. Some of the challenges that our presenters will be talking about today that concentrate specifically within the humanitarian context are issues such as cost of provision and purchasing of products, product acceptability, and the accompanying lack of product knowledge. So often products are distributed without any instruction. There's also a lack of infrastructure, or there's infrastructural challenges, so the lack of private drying spaces or product disposal facilities. And there's also a limited product mix, and this is all often within disrupted markets that aren't able to cater to people's preferences and choice. And of course, these challenges all kind of vary dependent on where within the humanitarian cycle we are. So the needs and challenges are different in an acute, rapid onset situation, say caused by an earthquake, to what they might be in a more protracted refugee settlement, for example, that is moving more from an acute situation to more developmental approaches. So we really need to be conscious not just of what the needs are, but what the situation also is. And then the final thing I think that we need to be conscious about is the complexity of the humanitarian space. I worked in BDBD refugee settlement in northern Uganda, or have been working there for the last couple of years. And BDBD refugee settlement hosts approximately 280,000 refugees. It's one of the largest settlements in the world. And I'm always taken aback by the fact that, 3 years ago, there was nothing there. It was just bush. And so there's a lot of actors, a lot of complex relationships, and a lot of actors coming together to address the needs of people who are displaced, and to provide them with the services that they need. And they all interact in a kind of a complex web of lack of resources or restricted resources, different political interests. And that all makes working in the humanitarian context quite interesting. And so I'm sure that my presenters will also talk a little bit about how we work within that context. So we'll start with a presentation from Anne Lincovello, who is a humanitarian advocacy advisor for the UNFPA. And Anne is going to talk a little bit towards the existing policy and recommendations, and look at how we move forward in the field of menstrual health, followed by Liz McNeil, who's the Regional Partnerships and Business Development Manager at AFRIpads Kenya. And Liz will be talking about about menstrual health from a supplier perspective. So she'll be looking a little bit at mainstream menstrual health and some of the procurement processes and stakeholders involved. And our final presentation will be by Shimira Nakalema, who's a training coordinator and project manager at WoMena Uganda. And she will be discussing experiences of addressing menstrual health supply needs in Ugandan refugee settlements with menstrual cups. So on that note, Anne, over to you.
Thank you. Well, I think 2019 is a turning point year for menstrual health management, and I have to give a lot of credit to WASH United as the advocacy leaders, in my opinion, on menstrual health, and for starting Menstrual Hygiene Day in May of every year. And they started that in 2014, and that advocacy has been a game changer, and so has the Academy Award received by the Indian producer on period end of sentence. And I thought it was brilliant how she ended her acceptance speech in Hollywood by saying, a period should be the end of a sentence, not the end of a girl's education. And so all of this advocacy has really ramped up awareness. And now I think we really need to look into sustainable solutions and increase funding for this. So next slide, please. I want to give you a brief overview of UNFPA's history and engagement with this. Now, what we know is there's 143 million people in need of humanitarian assistance right now. About 35 million of those are women and girls of reproductive age, and they have menstrual health needs. And that's a lot of women and girls who need menstrual products, education, their human rights, dignity, and most important, and I heard our presenters say this before me, is listening to the women. And believe it or not, this is still a challenge. It's happening across the humanitarian sector. It seems like common sense, but it cannot be given enough priority. So I just want to say that for UNFPA, we do have Dignity Kit programming guidelines. I'm going to talk about some of the guidelines that are available, starting with UNFPA. We started distributing Dignity Kits in the mid-1990s. Why? Because we started in our humanitarian work then, and that was an outcome of the International Conference on Population and Development that took place in 1994 in Cairo, saying sexual and reproductive health is a human right for everyone, and refugees, displaced persons, migrants needed this right to be protected and promoted. So also the distribution of hygiene kits, from which Dignity Kits originate, is a standard humanitarian intervention. It's outlined in the SPHERE standards to ensure hygiene, health, dignity, and well-being. And we developed our guidelines on this in 2013. And in 2018, we reached 3.3 million people, women and girls, with Dignity Kits in 54 countries. Next slide, please. So our approach, as outlined in our guidelines for our programming people around the world, it's, as I mentioned, primarily targeting women and adolescent girls. We focus on local procurement and assembly of the dignity kits to have a locally driven response and income earning opportunities. The contents are selected in consultation with local communities through coordination with other humanitarian organizations. It's very complex, as we just heard, and so that's to avoid duplication because there's so many responders and actors involved in these large responses especially. And they're customized to meet the hygiene needs of affected populations. And we know that different people around the world have different views of menstruation, different approaches, different acceptance of different products. And that's why it's so important to listen to the needs of women and girls so you can work with them to make sure their needs are met. Because as you know, you can offer them different things, but they're not comfortable with them and they won't use them if they're not consulted, and they need to be telling you what they need so you can respond and work with them to meet those needs. So now the guidelines led to the MISP. The MISP is the Minimum Initial Service Package for Reproductive Health and Emergencies. That's a standard guidance for everyone working in sexual and reproductive health rights field in emergencies. It not only includes guidelines, but it also includes instructions for organizing the working groups and the whole coordination mechanism for working in humanitarian situations to ensure the provision of sexual and reproductive health services and supplies. So you can see this, one of the first things it says in this guideline, it's important to first talk with women and girls to learn what they typically use, so then you can know what they need. And then it talks about culturally appropriate menstrual hygiene protection materials should be part of the non-food item packages and distributed to women and girls of reproductive age. So that's basically what it says within those guidelines. It doesn't go into great detail. Now we also have the 2018 Interagency Field Manual on Reproductive Health in Humanitarian Settings. Now this goes in detail into two areas: sex-specific hygiene facilities, because as we all know, it's not just about the supplies. It's about the cultural norms, it's about the inequality, it's about the shame, it's about the taboos, it's about education, gender norms, etc. And so if they have to go to a dirty toilet with no place to put used supplies, if they don't have a toilet, if the toilet is far away, if there's no water, etc., then this puts women and girls at risk, not only of not being able to ensure menstrual hygiene, but also at risk of gender-based violence. Now we see this in all settings, and this is something where all the sectors in a humanitarian response have to come together. So you can see what the guidelines are in this interagency field manual. So they're asking for safe and sex-specific hygiene facilities, appropriate washing facilities, including for adolescents with disabilities, and the provision of cloth or other culturally appropriate sanitary materials, and also to embed this into life skills education, which should cover many things, including puberty, fertility, menstruation, gender norms, healthy relationships, gender identity, bodily identity, and sexual orientation. So this is areas where menstrual health management comes into play at its core and working in these areas and as expressed in these guidelines. Now the new toolkit that was led by International Refugee Commission, IRC, and Mailman School of Public Health of Columbia University came out recently, I think it was 2017. You can see this is very comprehensive. This is dedicated solely for integrating menstrual health management into humanitarian response. There's 14 chapters, everything on training staff on menstrual health management, to needs assessments, to the provision of supplies, to transit, to shelter, wash, disposal, health education, vulnerable populations, education in general, protection, and monitoring and evaluation. And many organizations co-publish this very valuable tool that's available to everyone. And if you could, and on the next slide, you'll see all the co-publishers of this. I think this is a breakthrough for the field, frankly. UNFPA is continuously rolling this out to our field offices, and it's an excellent resource. And you can see all the other partners that are involved in this. Another one is, of course, the Sphere Handbook. There's the new 2018 edition, which has further information, and even that toolkit, which I just showed, did inform the information in the Sphere Handbook. So these things have a multiplier effect, and they're spreading around the world, and it's just wonderful what's happening with all the standards and guidelines now in this field. And as you can see in the Sphere, they really connect it to all of the different sectors, and they go into the social cultural issues, the taboos, how to address that, training teachers, how to incorporate this into schools, safe spaces, learning centers, the health sector, into education, shelter, and WASH. Very specific recommendations in the Sphere Handbook as well. So that's excellent. And next, please. So I'd like now to talk about moving forward. Now, I just got some information from Cox's Bazar from colleagues there. I'm sorry it's not on my slide, it came in late. But what they have found is that there's a high need there, according to surveys. So let me just give you some statistics. And that is that the assessments show that 75% adolescent girls in Cox's Bazar expressed an unmet need of menstrual hygiene products. That's from 2018. And we also know that menstrual hygiene health management is at stake due to a lack of clean water and a lack of a proportional number of sanitation spaces, bathing spaces, lack of washing and drying spaces for menstrual cloths, and a lack of waste disposal. And these are all very important. And according to the WASH CAP survey, a majority of women girls in the community prefer reusable cloths rather than, let's say, sanitary napkins or menstrual cups. So this is very good information to move forward. Now I can tell you that what UNFPA is doing is we're providing education to adolescent girls and young women on menstrual health management through life skills education. And we're also providing supplies. We did start, and this is interesting, to try to procure locally. And then there was a question of quality assurance of the local supplies, and it did end up being supplied from our supplies in Europe. So they ship over their menstrual supplies, and that's also interesting considering that they expressed a preference for reusable cloths. So there is, as you can see, always the issue of responding to what the needs are. And because also, given the limitation of sanitation and disposal products, disposal bins and things like this is a challenge, okay? So I want to say about moving forward that, as I said, we have a number of operational guidelines, including the recent ones. And there's always been much emphasis on dignity kits and how this should be done in a culturally sensitive manner. But as you can see from this menstrual health management, and this is a review paper that was done recently with our Eastern and Southern Africa region. And so these are recommendations coming directly from that. And it says that we need to go beyond the kit culture. We need more sustainable and strategic coordination. And in this region, there's pilot projects, and that's building an evidence base about what can be feasible in different contexts. And they do believe that a further documenting and sharing of experience might help to build a longer-term strategy and theory of change and approaches that are scalable and sustainable. And I think this is the way forward. And I think all of us today will be addressing this in our own various ways. That's it. Thank you.
Excellent. Thank you very much, Anne. And now next we're going to move over to Liz from AFRIpads.
Thank you so much for the introduction, Laura. Is my sound okay?
Yeah,
I'm going to take that as a big yes.
Yeah, no, loud and clear. Go ahead.
Perfect. All right. So again, my name is Liz McNeil, and I'm the regional manager, the regional partnerships and business development manager for AFRIpads in sort of the East and Horn of Africa region, based out of Nairobi. So hello from Nairobi, Kenya. What I'm going to be talking about today is really unpacking the supply chain in humanitarian response. If you go to the next slide, it's a bit of an overview. I'm quickly going to introduce who AFRIpads is and why we're here. A bit on mainstreaming the supply of reproductive health and MHM products in humanitarian context, and then a bit on the procurement process, stakeholder and supply chain challenges and best practices that we've seen, and then kind of looking ahead about how we can be proactive, offering some suggestions and talking about a pilot study that we have coming up, hopefully at the end of this year. So let me dive in. If you want to go to the next slide. So AFRIpads is a social business that manufactures reusable sanitary pads based in Uganda, where our manufacturing and production takes place. We supply these reusable sanitary pads to implementing partners across Africa and also into the Middle East as well, mainly working with INGOs, UN agencies, NGOs, and CBO partners. Like I said, we're a social enterprise. We've been operating for about 10 years, and we are also trying to be a global thought leader on MHM as a topic. Why are we here? Basically to offer the perspective of a supplier, but we're also a programmatic partner in emergency response and humanitarian contexts across the continent. Through implementing partners like UNFPA, like PLAN, IOM, Oxfam, we've also done work with WoMena. And what we do is basically deliver, we work with organizations who deliver development and humanitarian programming, providing really comprehensive menstrual health programming through the provision of the reusable pads, but then also capacity building work, including access to our education tools, training of trainers, and recently developed monitoring and evaluations framework. If you go to the next slide, so just a little bit about how MHM supplies have been mainstreamed in these contexts, and I won't go too deep into this because Anne has just talked quite a lot about this. But in terms of reproductive health supplies and supplies in this space, MHM has been one that's been, I think, given quite a lot of consideration, which I think is very good. Previously, only disposable pads have been considered a relief item, but the space has been really open to advocacy and awareness raising, and through pilots and product improvements and really partnering together on the ground in partnership with different implementing partners, we have been able to make a really strong case for reusable pads as well to become a core relief item for many of the organizations that work in these contexts. So as a part of the dignity kits or hygiene kits or menstrual kits, there will typically be a menstrual health item, whether it's disposable pads or menstrual pads. Often it's all also left up to the discretion of the organization and the staff there to make the decision what's best for the context. Let's go down to the next slide. There we go, which is hopefully looking like a very, very busy slide. What I wanted to really illustrate here is that the procurement process for humanitarian responses, both for acute and protracted responses, can be incredibly complicated with very many actors and steps. So it goes all the way from when an emergency starts through proposals going to funders, the approval of those proposals going to procurement, to the tender for supplies that we receive as suppliers or manufacturers, because sometimes there will be a mandate from the organization that they need to work with a local supplier, and so often we'll get called up by a local logistics company or supplier to say, can you supply to us, which adds kind of another step in there where if an organization is not ordering directly from a manufacturer, we either need to have already stocked a supplier or supply the supplier to then supply to the NGO or agency that is purchasing. Then they make their bids on prices. The bids are evaluated and selected based on a whole bunch of different requirements, typically price, delivery time, and adherence to technical guidelines or specifications, lovingly called tech specs. And then the supplies are purchased, they're delivered, received by the procurement, and then delivered to the field staff, and then on to the beneficiaries that receive them in the field. So the products pass through so many different hands at this point. And one thing that I realize that I've missed out on, and I know that many of my colleagues in the finance department would really kick me for leaving this out because it's really important, is that the very last step in this empty space should be that suppliers then get paid for this. And so this step is actually very complicated because oftentimes there's a requirement that the supplier or manufacturer doesn't get paid until the goods have been received. So it requires that the supplier or manufacturer has to be a large enough entity to be able to take on a 0% down payment and have like a strong trusting relationship that they'll actually get their payment after this process has gone through. And after the consignment has been delivered, it can take months even for the payment to actually come through because there are so many layers in the financial process to get all the necessary signatories, etc., to actually send the payment through. So very many steps from start to finish between when an emergency starts, when the products actually get purchased, and when they're actually received in the field. There's a huge drawn out timeline that can take weeks. If you want to go to the next step, or sorry, slide, I tried to put together a bit of a map here of the different stakeholders in the procurement process, a lot of whom were already outlined in the previous slide, but I wanted to really just highlight that it is not, procurement is not something that happens in a vacuum at all, and so many hands touch the procurement process. And it is all based around responding to the needs of beneficiaries as a result of a humanitarian crisis or event. A couple of ones that I've left out here are host communities and also volunteers on site that may be involved in distributions and things like that. And I really want to highlight that, again, this is really based on beneficiaries and serving their needs. But what has become kind of increasingly evident is that beneficiaries should be at the center of all decision making, but typically in practice are not. And I'm going to talk about beneficiary engagement a little bit later. So there's sort of a stakeholder map there. If we skip down to the next slide now, I want to talk a little bit about some of the challenges that we face throughout this this process. The first being timelines. In a humanitarian context, especially in an acute emergency, whether it's conflict or natural disaster, time is absolutely precious. I can't emphasize that enough, because every day that from the start or the onset of an emergency to when products are actually being distributed in the camps or on site in a location is days where people are being left with almost nothing in some circumstances. And like Laura said right at the beginning, is that this, menstruation does not wait. Menstruation does not care if you're in transit, does not care if you're living in an informal settlement, or if you don't have access to water or cloth or a pad. And so we need to completely recognize that in the procedures that we create within our organizations, time needs to be of the #1 kind of essence. And the process for procurement and distribution can really take weeks with all of these steps that I've highlighted. And these procedures, implementing organizations often have very, very rigid procedures and requirements that they need to follow. And I mean, rightly so that they are scrutinized procedures, because this is donor funding, and we need to make sure that it's going to the absolute best use. But these procedures can really compromise on the quality and the effectiveness of an intervention due to timelines, due to maybe pre-established notions or understanding of the contexts. And I'm going to talk a little bit about how we can kind of manage procedures where we're not compromising on following rules, and we're also not compromising on the effectiveness and timelines of an intervention. And the last one is one that I've already mentioned, which is the stakeholder engagement. Due to the constraints of the context that are often very, very complex situations, very, very low resource situations, it can be really difficult to manage and engage all of the necessary stakeholders. However, the beneficiaries are the core stakeholders that really should be the #1 stakeholder group that we engage with as much as possible, especially in the decision-making process, because it's their lives that are being impacted by everything that we do. And it is truly not as a result of, their decisions that they're in this situation in the first place. If we go down to the next slide, just to follow up the challenges with some of the best practices and recommendations. The first thing that we can do is be proactive, and all stakeholders can really take steps to be proactive in these contexts. Donors can be proactive by funding pre-positioning of supplies and opening up calls that are more inclusive of MHM and SRHR type interventions. UN and partner teams can be, the teams on the ground, as well as the teams in country offices, can be proactive in a number of different ways, including doing that proactive beneficiary engagement through data collection, through pilots, etc. And suppliers and manufacturers as well can be very, very proactive by ensuring that they're following the right requirements that are needed to work with the implementing partners on the ground. And also doing the necessary sort of marketing and awareness raising so that partners who are purchasing the supplies know about the different options that are out there. And another thing that I think is probably mentioned a couple of times, but I'm going to mention again for emphasis, is that not all humanitarian work is rapid onset. There are acute humanitarian contexts and also protracted humanitarian contexts. And the protracted ones really do give organizations and stakeholders opportunities to provide interventions that are very, very thoughtful and very, very conscious of cultural nuances, of beneficiary preferences, etc. Talk a little bit more about that in a bit. The next is to engage the beneficiaries. Sorry, just go back up. Thank you. So with the proper product knowledge for ease of use, for adoption, and basically overall preference, there is a number of different gaps right now in ensuring that an intervention or a supply that's provided is actually going to be adopted and used in the proper way if we're not giving that information and really engaging with the people who are receiving them. And so one way that we can kind of further engage is by using the distribution points as an opportunity for information dissemination and awareness raising and an orientation on the supplies that we are distributing, but also going one step further and including information on the topic of menstrual health and sexual and reproductive health. And also giving more opportunities for when beneficiaries can provide feedback and input. So more in-depth post-distribution monitoring, but also pre-distribution assessments as well. And the last one is a little bit more logisticy, which is developing something like a core pipeline or pre-positioning of supplies. And the development and implementation of a core pipeline is actually being led by a couple of key agencies in places like South Sudan that I'll talk a little bit more about. Pre-positioning stock and pre-qualifying items in high-risk zones helps really cut down the timeline for organizations to get their supplies in the hands of their staff on the ground and then in the hands of beneficiaries. So if you're pre-positioning stock in warehouses in country, and then also framework agreements with suppliers can cut down on those steps in between where there's a lot of product vetting, et cetera. And if we go down to the next slide, I'll give the example of South Sudan that has developed a core pipeline. And you can see that this core pipeline step cuts out a number of different procurement steps because the products have already been pre-qualified by 2 lead agencies and are already located in country, stocked and ready to be distributed as a donation in kind to organizations that apply for to use these products in their programming. And there's also another good example of the Rapid Response Fund in Ethiopia that's managed by IOM that also donates products in kind that they've either pre-vetted or pre-positioned in country. So in particular for MHM items, there are hygiene kits and dignity kits that organizations can access through this core pipeline. I'm going to try and speed through these next slides, just being conscious of my timing here. Going down now into what does it mean to be proactive, because that was one of the recommendations that I've said. First of all is do the research. In these protracted emergency contexts, or sorry, humanitarian contexts, you can do baseline studies to understand the context and understand the demographic, environmental, cultural factors that are really, really critical in understanding the needs of the beneficiaries. The next is to identify and pre-qualify the appropriate supplies. And I really want to highlight the term appropriate supplies, just like Anne said previously, because we need to understand what the product preferences are and what works in this specific environment. And then do the homework on who the suppliers are, and then vet those suppliers and the supplies for reliability and quality. Next is the framework agreements that I talked about previously, because they can really, really cut down the steps and the time with when an order is made or a request is made at a procurement department to when the supplies come in, because procurement departments can just go to this agreement and say, all right, we need reusable pads. Great, we've got an agreement already with AFRIpads, or for example, we know to just call them up and that they'll be able to supply for us. To the next slide, coordination, cooperation between the clusters. This is not my slide. There's a couple more slides in my deck here. Are they not? Oh. Thanks. I can keep talking about them as we go. So coordination and cooperation between the clusters, knowing who's responsible for these topics and how does it link with the program areas, and also who's responsible for the distribution of NFIs and other supply distribution, and how organizations can piggyback on those existing initiatives. Building capacity within staff teams and also within the communities, because there's a lot of organizations that utilize community health workers and other volunteers within their beneficiary groups that can be involved in the distribution process. And also, it's great to integrate these topics into the programs in responses, so that not only supplies are being distributed, but information as well. And lastly, be creative. Like I said, you can use distribution points as opportunities to disseminate products, but also information and education. And also this was also touched upon, but creating more sustainable solutions for supply chain, such as integrating these supplies into locally available markets. And I know that that's a shift with the focus on cash-based interventions, and we're going to be piloting some of those in a couple of our different project locations. Second last slide, I promise. Quickly, we're doing, hopefully launching a product preference case study in Ethiopia, where we're trying to evaluate what the MHM supply preferences are in the Somali region of Ethiopia in order to better equip our partners to making decisions on what the most appropriate supplies are in the case of a rapid onset emergency in these areas. We're hoping to partner with DRC Ethiopia, that's our plan. And it should be starting at the end of this year, really hoping to have good results from that. And that's just an example of how we can be a bit proactive on understanding the context better. And just a shout out to DRC is that this was the protection team's idea to do, and we're just happy to be a project partner. And the final slide here, just re-highlighting that menstrual health supplies are one of the reproductive health supplies that's already really been mainstreamed in distributions in humanitarian contexts, but we really still have a long way to go in providing comprehensive programming around supply distribution. And of course, reproductive health supplies as a larger health supply sector needs greater advocacy and mainstreaming to ensure that there's adequate consideration of in distribution within the humanitarian context. And we need to figure out the best ways that they can get distributed. So that's me wrapping up. Thank you so much, and I'm really looking forward to the comments in the Q&A.
Thank you, excellent. Thank you very much, Liz, for a very informative presentation. Shamira, do we have you online?
Yes, I am on.
Okay, fantastic. So over to you now, Shamira. I'm just going to remind you of time. We're a little bit over time at the moment, so if you can try to keep yourself to about 10 minutes, and then we'll still have a little bit of time for questions at the end.
Okay. Thank you so much, Laura, for the introduction. My name is Shamira, as Laura said, and I'm going to talk about menstrual health in the humanitarian context. WoMena has done a lot of interventions in the humanitarian context, but I'm going to present two of them that were very successful. And as we can see around the globe, Uganda is like one of the largest hosts of refugees, specifically or mostly from South Sudan. And over the last 2 years, according to UNFPA, 86% of the South Sudanese that arrive in Uganda are women and children. So we find that girls and women, as most of the presenters have been talking, they often lack the ability to manage their periods. And we often see that different actors in the humanitarian context don't think that the menstrual health is life-threatening during the acute situation. There is actually general MHM monitoring and evaluation in different refugee settlement and implementation models. We also see that although menstrual health products are being distributed within the refugee settlement, a number of interventions have included reusable pads, but there is no evidence of introduction of menstrual cups and in the humanitarian programming. Next slide, please. So WoMena has implemented different interventions in Uganda in collaboration with different actors. Next slide. In different actors, including ZOA, CARE, Save the Children, and World Hunger. We've worked with World Hunger in Bidibidi, as Laura said. We've worked in UNFPA with ZOA and in collaboration with CARE International. We've also worked with Save the Children, and we have like upcoming projects in Chak 2 and Changwari refugee settlement in Western Uganda. So we have had a pilot conducted in 2017 in Rhino refugee settlement, The project was carried out in collaboration with ZOA and WoMena Uganda, and the study aimed at the project aimed at introducing both menstrual cups and reusable pads to girls and women in the refugee settlement. It was integrated into ZOA Teach Me More program, and the target beneficiaries were primary schools, as I said, primary school going girls, guardians, teachers, and the village healthy team. So we aimed at assessing the acceptability, feasibility, and potential health and social impact of introducing menstrual cups and reusable pads in these two refugee settlements. Next slide, please. So we see that the different models that we used in this intervention included, next slide. We used different models in this intervention, and one of them was to, the previous slide, one of them was to provide both menstrual cups and reusable pads in the schools, in one school, and another one was to provide a choice to the girls in the schools and women of the reusable pad and the menstrual cup. And another model was to give a school or girls in that specific school menstrual cups, and another model was to provide them with only reusable pads. In each intervention model, senior women teachers, members from the local village healthy team, all participated in the menstrual health training and received products in order to be able to support the girls, women, and guardians in the community. Next slide. So we collected data at both baseline and endline among the 180 participants. Next slide, please. We collected questionnaires and conducted focus group discussions. As the data set is kind of small, but we can't draw a conclusion. But we think that this data provides insights into potential opportunities, challenges, and other opportunities in the use of menstrual cups and reusable pads in different refugee settlements. At the end of the intervention, when we did the data collection, participants expressed a general satisfaction with the product provided. For example, we see that most of the participants, 50%, 52% answered that they used their menstrual cup at most, 48% answered that they used the reusable pads at most, and there is a fairly equal distribution of product preference. Participants also expressed using the products interchangeably according to personal preference. So we see that even if these people received both the products, there was satisfaction with both the products, and those who received the product, although they reported using products equally, they were generally more satisfied in the menstrual cup in terms of comfort, being able to carry normal activities and see that there was no smell while they are using the cup. So the data also indicates that participants felt more comfortable changing reusable pads in either home or at school. Next slide, please. So one of the significant findings from this pilot was that participants who received both products, next slide, reported using the product interchangeably and adopted it to the contextual constraint. We find that some of the girls that received both products reported using the menstrual cup during the rainy season and reusable pad during the sunny season, because that is when they could dry the reusable pad, and that is when they could access some water to wash the reusable pad. Next slide. Next slide. Next one. I finished that. So we see that they reported different benefits. For example, for the reusable pad, Some of the reported benefits are the same as the ones from different contexts, but we see for this specific context, they reported no itching and leakages, comfort and freedom to play, saving money, being easy to wash, and no smelling for the reusable pad. And for the menstrual cup, it was easy to wash and disinfect using lesser soap for cleaning, easy to empty, no leakages, no need to wear underwear, comfortable when it is worn, being able to jump and sit anyhow, working freely, it is durable, long-lasting, and sometimes no one will tell that you are in your periods. Next slide, please. We have had another intervention.
Shamira, just to note that you need to start wrapping up. Just note.
Yeah. Okay. So another slide, please. So we've another intervention in Mvepi refugee settlement, and this intervention was conducted in collaboration with CARE International. It was funded by European Union Civil Protection and humanitarian aid. The aim of the intervention was to assess the visibility of menstrual cups as menstrual solution in Mvepi refugee settlement, but also to improve the capacity of women to safely and effectively manage their menstruation and improve general knowledge and perception around menstruation. The target group were 20 trainers who included 6 male, and these trainers were given information in menstrual health management for sustainability, and 8 beneficiaries that included CARE gender-based violence support group in Mvepi refugee settlement. The aim, as I said, was to give education and distribution of menstrual cups to both the trained trainers and the beneficiaries. The project took place ended in October 2018. The intervention design included the exploratory visit where we did a sensitization on menstrual health management and menstrual cup to the community. We did a training of trainers in this exploratory visit. Then another phase was the trial of the menstrual cup by the trainers before they delivered the training to the beneficiaries. We had the phase of training of the beneficiaries. The beneficiaries tried out the menstrual cup, and then we also did endline. When we are doing the endline, we use different evaluation tools, including the knowledge retention tests, questionnaires. We had menstrual calendars and menstrual diaries. So the methodology used, because the menstrual cup requires hygiene, we made sure we promote hygiene. We distributed a menstrual kit that included a reusable menstrual cup that, as you can see in the picture, that has a towel for pain management, soap for hand washing, a mirror for a girl to know where she's going to insert her menstrual cup, and a metal container that served 2 purposes of disinfecting and also storage. But because we also wanted to create sustainability, we ensured male involvement to be part of the project, to act as champions, but also promote the project. Next slide, please. So we collected data at both endline and baseline, and we saw that some of the fears that girls and women had while we are initiating the project included the pain or stretches that the menstrual cup might cause when you're inserting the menstrual cup. The fears of leakages when you're using the menstrual cup, fears of the cup disappearing inside the body, fears of the cup failing out when you're urinating or defecating, then fears of the cup that it might cause infection, and while disinfecting the cup, sometimes women said that there's a possibility that their children might see the cup and have questions about it. Next slide, please. So you find that we collected data, and according to this slide, as you can see, our intervention is supposed to last for 6 months. That is what we recommend. I've heard Liz talking about ensuring that there is enough time provided for the intervention while it is being implemented. But this one specifically took 3 months, and we did distribution and education in the first phase, as you saw, and we did a 3 months follow-up. According to this slide, there was a high uptake at the end of the intervention. We see in the first follow-up, it was 74% of uptake. Then the second follow-up, it was 85% of uptake. So in the first follow-up, we conducted the follow-up and the refresher training where we provided a solution to the challenges girls and women are facing while they are using the cup. And in the next follow-up, we found that there was improvement or high uptake of the cup use. And that was the same case with the last follow-up that was 80% uptake of the menstrual cup use. Next slide, please. So, next slide. Hello. Next slide, please.
Hi, Shamira.
Hello?
Shamira, you can keep going. The next slide is up on the screen.
Okay. So as we saw that there was different challenges that girls and women faced in the intervention, we find that most of the women appreciated the program, and we saw that there was women empowerment. According to the slide, women reported high acceptability of the menstrual cup, and we see that because we had like training of trainers in the first, there was sustainability, male involvement where we involved the leaders. It was really important because male participants were in position to spread the word. They reported high comfort level of menstrual cup use. Then there was low water usage, economic impact, and high practicing hygiene guidelines. According to this slide, we see that there is a situation where the intervention was not done, and we see that girls and women were facing challenges. But after the intervention, there was change. Men could talk about menstruation, and they could also openly talk about it in the community, and women were in position to also talk about it. Some of the challenges that we faced in this intervention is talking openly about menstruation in the community. When we are implementing, we also faced challenges of user perspective of the menstrual cup, initial fears related to menstrual cup use, community perception of the menstrual cup use and care guideline, keeping the cup away from children, and supply-related challenges included product cost, that is import, and also accessibility in the settlement. Then we have product acceptability in the community, lack of product knowledge, contextual restriction to product use, and limited choice of the product. So we see that, next slide, some of the recommendations that we would give while implementing a project would be that it is very important while any organization is implementing a project, considers choice of good option of the product, as girls and women have difficult or different preferences for when to use which product and different reasons for choosing one or other products. Reusable pads require physical inputs which are not always available in refugee contexts. However, the provision of reusable pads sometimes requires less sustainable follow-up and support compared to menstrual cups. Menstrual cup need more inputs in terms of training and sensitization over a long period of time. But with time, there is less physical input. There is understanding of existing access to product. Participants in these two interventions reported various overlapping programs. So it is very, very important while going to deliver this intervention to know which actors that have already done some interventions. Although the school-based approach worked very well in this intervention or in the first intervention, we see that many mothers and guardians did not come up for follow-up. There is a need to ensure that they are supported constantly and they are always available so that there is continued support. Thank you so much.
Thank you very much, Shamira, for your informative presentation. And thank you also, Anne and Liz. I think we've had a really great kind of overview of menstrual health supplies from different perspectives. So from kind of policy and guidance perspective, from a procurement and supply chain perspective, and then more from a kind of programmatic implementation perspective. Unfortunately, it does seem that we're over time a little bit, and we're not going to have time for questions. But Alex, I don't know if you would like to comment, but I think we have received a number of questions and people can submit questions to the question box, and we have a way of responding to those. Alex, do you want to comment on that?
Yeah, great, thanks Laura. Yeah, so we will take the questions that are coming in from the questions box and we'll work with the presenters to get some responses written, and we'll share those through the listserv, as well as people will be able to write in questions through the listserv as they come up freely.
Excellent, thank you, Alex. So I would just like to say thank you for everyone for joining us, and thank you to the presenters. And again, just to reiterate what I started with in the beginning, is that the fact that we are having this webinar, the fact that we are having these conversations is excellent progress. And there's been various people kind of within the field working to push for a recognition of menstrual health and menstrual health supplies as a part of a kind of holistic humanitarian approach. And I think we've gotten some great tips and kind of comments here in terms of how we can move that conversation forwards. And we'd be very happy to hear from anyone who's listened to the presentations with your questions and continue the dialogue. So from my side, thank you very much everyone for joining. Alex or Nancy, do you have anything you want to add to the end here?
This is Nancy Muller. Thank you so much again. It was a great set of presentations, hugely informative. And I know one question was, will they be shared with the participants? And I'm sure they will be. So thanks for all this rich information and all the attention to menstrual health in humanitarian settings. And let's stay tuned for a future webinar on more MHM issues.
Great, thanks so much everybody. We will be in touch, and please feel free to share the recording of the webinar that comes out in the next couple of days with your colleagues who may have not been able to join today. Thanks so much everyone.